one of the questions I have for you is, what's the difference between a sudden cardiac arrest and a heart attack?
That's a great question because, as you know, that's mixed all the time. Everyone says this player had a heart attack. This player had a heart attack. They did not have a heart attack. They had a sudden cardiac arrest. And there's difference between sudden cardiac arrest and sudden cardiac death, actually, right? And so
Mm.
again, that's why when we're thinking of those studies, the methodology is all off because some studies are using death, some are using just people who are arrested but were resuscitated. All these things are off. The difference is that with a heart attack, what's happening is that you have arteries in the heart, and those arteries, which we call the coronary arteries, are being immediately blocked off, right?
Mm.
They're clogged because of the plaque. And so that leads to an acute obstruction. And now there's no more blood flowing through, right? So when I tell my patients, think of it like the 405 freeway, right? You have the freeway that's completely open. And if it's 2 a.m., you can speed as fast as you want, right? The cars are the red blood cells, just driving along, no problem. But if you're trying to speed at 100 miles an hour, like you can do at 2 a.m., and you're trying to do that same thing now during 5 p.m. rush hour traffic, when there's a lot of congestion, that car, those red blood cells are not going to be able to go. And so when someone is doing an activity, they're exercising, or, the classic thing we see on the movies is that there's an argument and then they have a heart attack. It's because their blood pressure is rushing, their heart rate is going fast. Those red blood cells are not trying to get through a small artery that's clogged, and nothing can get through. And so if nothing can get through that artery, the heart muscle dies. That's a heart attack. Whereas with sudden cardiac arrest, this can happen with completely normal coronary arteries. This can happen with completely normal heart valves or completely normal heart muscle. It's just a irregular rhythm that happens with the heart where you suddenly have cessation of electrical activity and your heart literally stops for many different reasons. And now your heart has truly arrested. It went from beating to arresting. And you go into a ventricular arrhythmia, ventricular tachycardia, ventricular fibrillation, and you die, essentially.